And do you mind pulling up the slide deck? Thank you. Okay, good afternoon, everyone. My name is Kelly Williams. I'm the Director of Human Services at MAG. We are excited today to launch the official 2022 Supplemental Notice of Funding Opportunity from HUD. This is a new funding opportunity from HUD for our continuum of care, for continuums of care across the nation. And today we're going to discuss what that looks like, what the funding opportunity looks like, how you can apply, where you can find additional information and resources, what's eligible for this funding, and other details. I am joined today by my colleague, Katie Gentry, who's a member of our homeless team as well here at MAG, and others. We will be watching the chat. If you have questions during the presentation, please feel free to put those questions into the chat, and we can either answer them after the slide or we can answer them at the end. This is a 2-hour webinar, and again, it is being recorded and the recording will be posted for you to review. If you have any questions, again, please put those in the chat, and for that, we will go ahead and get started. Next slide, please. So what is a continuum of care? For many of you, this is common knowledge and understanding, but we have potential new partners on today's call. So we want to give a general overview of what the term continuum of care means. In 1994, officials at HUD came up with the idea of a continuum of care, although it did not become law until 2009, when President Barack Obama signed the HEARTH Act, providing a congressional authorization into this specific process. The term continuum of care is used in many different ways and can refer to the planning process, the collection of stakeholders involved in the planning process, the geographic area covered by the continuum of care, or the actual grant received from HUD. The goal of this continuum of care process is to create an annual plan to end homelessness. The continuum of care process involves compiling information about homelessness in the community, including information about homeless populations, inventories of homeless assistance resources, and the information is used to develop a list of priorities for funding, which help determine how much funding a community will receive and for which projects. The HEARTH Act reauthorized the housing title of the McKinney-Vento Act. HUD began issuing regulations in 2011 when they released the interim regulations of the Emergency Solution Grant and Homeless Management Information Systems. It's a lot of fancy language to say. We have a continuum of care here in Maricopa County. We are one of 3 continuums in the state of Arizona. Prior to the rules, continuums of care have been encouraged to undertake several additional planning and administrative tasks, but without codified definitions of the associated responsibilities. There are certain groups that are specifically called out by the HEARTH Act who are included in this process and may apply. Those include nonprofit homeless providers, victim service providers, faith-based organizations, governments, businesses, advocates, public housing agencies, school districts, social service providers, mental health agencies, hospitals, universities, affordable housing developers, law enforcement, organizations that serve veterans, homeless individuals, and formerly homeless individuals. So this is our continuum of care, and MAG, the Maricopa Association of Governments, is the applicant for continuum of care dollars through HUD. So if this is your first time attending one of these webinars and this language is new to you, we would highly encourage you to go on the HUD website and do some basic reading about the continuum of care, and come over to MAG's website as well and read about what our continuum of care is, and there's history information there as well. Let's go to the next slide, please. This is what the governance of the Continuum of Care Board looks like for our continuum here in Maricopa County. We have the board, we have a committee, a coordinated entry subcommittee, data subcommittee, emergency services grant subcommittee, lived experience, local jurisdiction, rank and review. And then, as I mentioned, MAG is the collaborative applicant. And then we have coordinated entry leads. UMOM and the Human Services Campus serve as those leads, and we'll talk a little bit about what coordinated entry is in just a moment. And for HMIS, our HMIS contract is with the company Solari. Yes, to answer your question, this presentation will be posted online along with a copy or a link to the webinar, so you will be able to review this in the future. Next slide, please. What are the COC required elements? So what do we have to have as members of, or to operate our coordinated entry system? We what do we need to have to operate our continuum of care? We must have coordinated entry. We must participate in the homeless management information system, and we must operate with the housing first model in mind. And again, we're going to go into more detail on each of those. Next slide, please. So what is coordinated entry? Again, if this information is new to you, we're going to do a very brief overview here, and we would encourage you to research coordinated entry both nationally and locally to have a better understanding of it. But in a nutshell, coordinated entry is a process developed to ensure that all people experiencing a housing crisis have fair and equal access, are quickly identified, assessed, referred, and connected to housing and assistance based on their strengths and needs. There are several different ways that coordinated entry system can work. In our community, we have a coordinated entry point for families, which is UMOM, and we have coordinated entry points for single adults, and those are operated through the Human Service Campus. Are there any questions about coordinated entry before I move forward? The goal of the coordinated entry system is to connect those experiencing homelessness to services, again, based on their unique needs. The first section of the homeless population, there are approximately 14,000 to 15,000 deduplicated individuals that come through this system annually. And the coordinated entry system really works to help match housing services, both options for housing and both the services needed for that person to be successful with the person's unique needs or the family's unique needs. We place about 2,000 households in one or more of these interventions annually, and we assess about 8,000 households each year through this process. So it is a way for individuals to come in, be assessed through a tool, and potentially be put on the by name list to receive housing and support services. So Dr. Padilla, I would recommend, that is a complicated question. I would recommend, I can either loop back with you or we can talk more about it offline. The coordinated entry system, how it all works is, I am doing the general overview at the moment, but we can get into more detail if we have time at the end as well. So we'll put that, we'll hold on to that question for the time being. Let's go to the next slide, please. So what is the Homeless Management Information System? The Homeless Management Information System is a local information technology system used to collect client-level data and data on the provision of homeless individuals and families and persons at risk of homelessness. Each continuum of care is responsible for selecting an HMIS software solution for HUD's data collection, management, and reporting standards. As I mentioned, we have a contract with Solari to do this work for us. Our coordinated entry partners and our partners across the continuum of care do use the HMIS system. It is a database of individuals who are being served through the homeless system or who are waiting to be served through the homeless system. And it is a requirement of this grant funding as well. There are, let's see here. Okay, that's what I have for this slide. Again, I know we have a representative from Solari on the call, so if we do have any larger questions about the HMIS system toward the end, hopefully they can help us with those as well. Let's go to the next slide, please, and talk about Housing First as a model. Housing First has been emphasized again and again by HUD officials through webinars and in writing that it is a key component to this funding opportunity. If you are applying for these funds or you plan on applying for these funds, we highly recommend that you keep Housing First as an evidence-based model in mind when writing your summaries. It is a requirement for this funding. Housing First as a model prioritizes people experiencing homelessness. It reduces as many barriers as possible to get people into housing. For example, you do not have to be sober to come in through a Housing First model if you're following the evidence-based practice. And it works with landlords in creative ways to try to help keep those people housed while services, appropriately tailored services, are provided to either the family or the individual. So again, it reduces as many barriers as possible from getting homeless individuals into housing as soon as possible or into shelter as soon as possible. Let's go to the next slide, please. So for those of you who have experienced this before, you know that MAG, our team applies annually for a notice of funding opportunity through HUD to provide homeless dollars for our region. This is a different opportunity. It is a secondary opportunity. HUD had a pool of dollars that they were able to pull back from continuums that were not spent in the past. They had over $300 million that they had recouped that had been previously dedicated to help fund continuum of care work. They took that money and they put out this supplemental NOFO, this one-time funding opportunity, specifically to address the needs of unsheltered individuals with severe service needs. Let's go to the next slide, please. So when we were presented with the opportunity to apply for this funding, we jumped at the chance, recognizing that yes, it is an administrative task. It is quite a bit of work. However, it is an excellent opportunity to bring almost $28 million new dollars to our region, specifically to address the needs of unsheltered individuals with severe service needs. And we knew that we had to take the opportunity at hand. Next slide, please. So how is this funding opportunity different? It is a one-time funding opportunity that goes for 3 years. So if you are awarded through this grant, if we are awarded through this grant, we will receive one amount of money that you have up to 3 years to spend. We have qualified for up to $27.9 million for our continuum. Each continuum's amount of total funding was determined by HUD and released in Appendix A, if you would like to review that. We will again let you know where we're posting all the official documents and where you can find the HUD documents for this funding opportunity. This funding opportunity is very specifically focused on both housing first, utilization of the homeless management information system for supportive services for those who are unsheltered with severe service needs, race equity, and those who have had lived experience. In the HUD webinar and also in the National Alliance webinar, it was emphasized again and again, if you can have people who have lived experience help you with your application and talk through your application, if you can have folks who are members of people of color who can also help with your application and be a part of the application process, they really want to see those voices represented in these approaches. And this funding is for new projects. New projects are not always funded through COC dollars or HUD dollars with the NOFO. This can be new projects. We'll talk about what you can spend on and what you can't spend on in a future slide. But this is an opportunity to partner in new ways with new providers and new social service supports in the community who may not previously have been involved in continuum of care work, to look at the solution to working with our unsheltered folks who have these severe service needs in a new way. Let's go to the next slide, please. So what are the eligible project types? For housing, we have permanent housing, joint transitional housing, and permanent housing with rapid rehousing. There is an additional supportive services only funding option. So if you are a service provider, but you do not actually do the housing, the supportive services only is an option. There's also funding available for HMIS, the Homeless Management Information System utilization. And there are dollars available for planning of the COC, so for the work that MAG does. What you don't see here is funding for emergency shelter. That said, you also do not see funding here for acquisition or rehabilitation of current housing options. So you cannot apply for these funds and plan on buying units. You can apply for these funds and plan on providing vouchers to individuals, but the actual acquisition or rehabilitation is not allowed. Let's go to the next slide, please. So activities eligible within a COC program. Acquisition, new construction, not allowed. And if you are, and I'm going to keep saying that because we don't want you to spend all this time applying for these funds and be confused that there may be a gap there. There is no gap for acquisition or new construction with these dollars. If you are interested in reading HUD's the small print detail on that, it can be found at this 578 Part D. And again, you will get a copy of these slides and it is hyperlinked and that'll take you right to the final information from HUD on this. Let's go to the next slide, please. So who can you serve with these dollars? HUD has very specific definitions on who qualifies as homeless as category 1 and the imminent risk of homelessness, which is category 2. Both of those, again, you can read the regulations to see if the people that you're working with qualify. Again, we provide the link here. Those fleeing domestic violence or attempting to flee are also eligible. There is no age category on these dollars. So if you have individuals, if you have families with young children who are experiencing homelessness, everyone in the family is also eligible.
Kelly, can I just add, category 3 is not an eligible expense. We are not asking for a HUD waiver on that. Category 3 would be people who are fall in that prevention category. So we're stopping them from experiencing homelessness. That is not something that our community is currently preferencing through coordinated entry, and it is not something that we're going to ask a HUD waiver on because we do have so many folks in category 1, 2, and 4.
Thank you, Katie. Okay, let's go to the Jean. Jean, I see you have your hand up.
Sorry,
okay.
Thank you. Just to kind of add on to that, can you tell me like who was responsible for making that decision, and do we, as an organization, do we really want to limit ourselves? Because I see that prevention ongoing is kind of a really big issue. I do understand that we have a lot that fall into the 1, 2, and 4 categories, but as you know, it's easier to keep people housed than it is to rehome them. So could you kind of expand on that a little bit more?
Yeah, actually, HUD won't even let you apply for category 3 unless you are under certain benchmarks for 1, 2, and 4 under this exemption piece. And we would have to be looking at applying for that for our annual NOFO dollars also. And we're just, unfortunately, like that is not the situation we are in right now because we have too many people experiencing homelessness.
Okay, thank you.
Yep, thanks for the question.
Okay, we're going to move on to the next slide. Unless, Jean, do you still have other questions? Your hand's still up.
Sorry, I'll take it down. Thank you.
No problem. Yep, no problem. Okay. So let's talk about other musts. I know I'm going to sound a little bit like a broken record here, but I'm going to keep repeating this. If you are applying for these dollars, regardless if you're applying for social services or, excuse me, the service only dollars, the housing dollars, the HMIS dollars, you have to keep housing first in mind. We have to see housing first, the model reflected in your application. Coordinated entry and HMIS participation is required. Again, that for those who have been working in this industry, that should not be surprising. For those who are new to this funding, if there are questions about how you work with coordinated entry or HMIS, we can talk through those with you. Your projects must be in coordination with our Continuum's plan for serving homelessness with severe service needs. Katie, would you mind giving a little more nuance to that, please?
Yes, we are will be drafting a plan for serving homeless with severe service needs. This is part of the application, part of the collaborative application to HUD. The majority of our points for this funding is based off of this, and it's kind of everything our community has been working on in tandem with the board strategic plan of really focusing on folks who are experiencing unsheltered. That plan has not been completely drafted yet at this point, but we will be working on that over the next month. And if folks have specific questions or specific pieces that they're interested in highlighting, please reach out to us.
Thank you. Jean.
So just a real quick clarification on the coordinated entry. So that means you have to be officially designated as a coordinated entry site. So like as an example, Glendale's Community Action Program, I don't believe is currently officially designated as a coordinated entry site. So we would not be eligible. Is that correct?
No, you don't have to be a coordinated entry access point. You just have to participate in coordinated entry. So by participating in HMIS, you either need to have an outreach team that is referring and taking, if you are a housing project, you are going to be taking your referrals out of coordinated entry. If you are a supportive services only, we would anticipate that based off of that project being approved, that there would be conversation about becoming a coordinated entry access point because you will be creating that much more access. The coordinated entry, and we would expect you to start coming to case conferencing with coordinated entry and starting to talk about the individuals that you are serving through your outreach if you're doing SSO projects or through the supportive services that you are offering, or on the housing side, that is how you are taking all of your referrals.
Okay, perfect. Thank you.
You're welcome. And the final two, again, race equity planning and lived experience voice inclusion are critically important to these applications. So we really encourage you to bring your employees who have lived experience, bring individuals who are people of color to the table, have their thoughts included in the creation and the partnerships that you would like to create to better meet the needs of our unsheltered population across the region. I think I saw another question pop up here.
Yeah, I can, couple questions
Okay.
in the chat. Can folks, are families eligible for this expense and not just, or for this NOFO and not just individuals? Yes, as long as they meet the definition of severe service needs and are unsheltered. This is specifically targeted at those populations. And then the second question of, can supportive services only projects fund emergency shelter, or can fund supportive services at emergency shelter? The answer to that is yes, they cannot, however, fund emergency shelter bed or the operations of the emergency shelter itself. But as far as case management at emergency shelter, that is an eligible expense. The definition of severe service needs. That is, there is quite a bit of description in the notice of funding opportunity, which we will link at the end of this. But it's going to be folks that are really high needs, high cost, are not seeking services right now. So a lot of our unsheltered folk, a lot of the folks that are experiencing unsheltered homelessness in our community consistently fall into this category.
And Dr. Padilla, I would add to that there were several individuals who asked that specific question of HUD officials to define severe service needs, and they held back on an official definition. I think the idea is that severe service needs look different in different communities depending on what services are available. But these are the individuals who, as Katie mentioned, likely have more than one need and either have not received services or are not being successful in being housed. It can be a little frustrating when you ask for specifics like that and then we don't have them, and I apologize for that, but that's the gray area we're working on with this supplemental NOFO. Okay, I'm going to move on to the next slide, please. So one other way that this funding opportunity is different from our typical annual funding is it does require quarterly reporting. So if you are considering applying for this, know that you will be reporting into HUD quarterly on your activities, on your budgeting, your funding, et cetera, how things are going and with the outcomes that you've listed in your application. Hopefully that does not prohibit anyone from applying or keep anyone from applying. Next slide, please. So what does our timeline look like for this? We typically get about 18 weeks with these notice of funding opportunities, which sounds like a long time until you're in the thick of it and you realize how quickly those 18 weeks go by. We are in the middle of week 5 since this has been announced. Since then, we have had the scorecards for the 3 different funding options approved by our Continuum of Care board. We are having obviously our kickoff available currently. We will have applications live on our website this evening, along with a copy of this webinar and the PowerPoints. And we will make sure that you have a link to where those will be found by the end of this webinar. We'll put it in the chat for you. On August 2nd, we are asking that if you are planning on applying for these funds, that you submit an intent to apply for us. That intent to apply form will also be posted to our website by the end of the day today, so you can let us know. Part of the reason why that's so important to us is we need to put together a rank and review committee specifically of individuals who do not work for organizations that are planning to apply for these dollars, so we can bring together colleagues to review the applications and to select folks that they think should be funded with these dollars. To do that, we need to know who's planning to apply. So that's very helpful to us. The applications are going to be due back to us August 19th. Between September 12th and 15th, we're going to ask those rank and review individuals to help go through all of the different materials and again, review them, rank them. I mean, the name is pretty self-evident. On September 26th, our Continuum of Care board meeting happens and they will approve the preliminary priority list, ask any questions of that rank and review group to see why they're suggesting the funding decisions they're suggesting. If for whatever reason your application is not selected and you would like to appeal, you will have up until September 28th to appeal, and we can go through that process with you. And then on September 30th, the COC will have the opportunity to finalize their vote on the funding, the agencies that are in the organizations that may be funded with these dollars for our application up to UD. On October 7th, all final project applications are due in eSnaps. eSnaps is the HUD portal for submitting applications. And on October 20th, all applications are due to HUD, including ours. We will be expected to submit a planning application as well. Ryan, I see your hand is up.
Thanks, Kelly. Given that today is Wednesday and August 2nd is, I don't know, next Tuesday, is there any flexibility to extend that to the end of the week so that those of us who are considering partnering can just have a little bit more time to determine what our roles are and make sure we put together a good notice of intent to apply?
So I think we can, I don't think there's an issue with us postponing the notice to intent or the intent to apply deadline, but we will not be changing the draft application to MAG date. So it would, Katie, do you want to jump in?
Yeah, I think we can extend that to August 5th. I will say an intent to apply is really just like, we're interested, here's a brief paragraph of what we're thinking about. It's not necessarily anything hard and fast, and we're not holding you to it. It's really for us to understand, are we going to have 10 applicants? Are we going to have 45? More than anything else. Do you feel like August 5th is enough time? That's a week from Friday.
I think that would be perfect. Just give us a couple more days to, because we're bringing multiple people together to have these discussions. That would be helpful. Thank you.
Yep.
We can update that. And this timeline again will also be posted to our Supplemental NOFO MAG website. We will make that change. Jean.
Kind of say along those same lines. Thanks, Ryan, for bringing that up. So if, as an example, we don't submit an intent to apply and then something changes, we can still submit our local draft application by August 19th. Correct. Okay.
You can. This is more
Okay.
for your MAG staff planning. It helps
Gotcha.
us get our ducks in a row.
We'll do our very best. Thank you.
Okay.
I wanted to respond to Natalie's is August 19th submittal a hard deadline? It is. Unfortunately, this is a much tighter timeline than it seems. We have to give our rank and review subcommittee time to review before they have interviews with you all, and then they have to turn it around for the board meeting. So unfortunately, August 19th is the latest we could push it to give us time to review applications, making sure everything that you all are applying for is eligible expenses, and then give our rank and review time to also review those applications.
The good news is we have our applications ready to go. They will be up on the website for you all this afternoon. And you do have the MAG team, our homeless team, for technical assistance. If you have issues along the way, we'd be more than happy to speak with anybody who's interested in applying for these funds. We want you all to be successful at this. Okay, are there any other questions about this timeline? I know it seems very fast. What I will say is if you have never applied through the eSnaps system, we do have a couple slides on that as well to give you some technical assistance on how to do so. We encourage that you familiarize yourself with that process as soon as possible. Let's go to the next slide, please. To get into the priority populations, or excuse me, the policy priorities for this funding, we just want to again emphasize what you should be keeping in mind when you're applying, when you're creating your application or thinking about how you might want to spend these dollars. So I'm not going to read this to you. Obviously, this is for unsheltered homeless individuals. These are not for individuals who are currently receiving a housing voucher. These are folks who are more or less our chronic folks. They're out on the street. They're unsheltered, not just chronic, but all unsheltered. Okay, I'm going to go to the next slide. The policy priority also includes providing assistance on tribal lands for our region. We do have several tribal partners, and we would encourage applicants to consider partnering with our tribal partners or tribes to apply for these funds as well. Next slide, please. They are looking for a broad array of stakeholders. So one of the examples they brought up multiple times, again in both webinars, was please consider how you can partner with the state Medicaid agency. Please consider how you can partner with the VA or other agencies that have potential benefits available to the individuals you're trying to work with, and come up with a creative solution together. So it's something else for you to be thinking about. In our community, we know that we have several groups of people that we would like to have more participation from in our continuum of care, one of which is faith communities. So if there's an opportunity for you to partner with a faith community as well, we would like you to take that into consideration. Again, keeping in mind that that lived experience and racial equity voice needs to be a priority. Okay, let's go to the next slide, please. Oh, I got ahead of myself. So advanced equity. Again, this is not just people of color, but also our LGBTQI population, et cetera. Let's make sure that their voices are represented and their needs are represented in the planning and the application process. If you need more information on this, we do have a race equity plan on our website that helps identify where there are gaps currently in our continuum. And you're more than welcome to use that information in your application as well. Okay, next slide, please. I think I've beat this horse dead, but again, we need to be keeping the housing first approach in mind through every process in this, which is engaging landlords and property owners, making sure to help get people housed first and then deal with their ongoing severe service needs. And if you have any questions about that model, we'd be more than happy to answer those as well. Okay, next slide, please. So the application, let's go into some of the details. Next slide, please. Katie, you want to talk through this?
Sure. So just to give you kind of a context of the Continuum of Care application, it's 3 parts. So the consolidated application is the piece that MAG prepares. It does include a plan for serving homeless with severe service needs. The second piece is the project application. So that is everything that you all are creating and submitting to us. The local application will just be submitted to MAG, but the eSNAPS HUD application will be what is submitted to HUD to be considered. And finally, there'll be the priority listing of projects. So that is what our rank and review will create to list projects from top to bottom and decide who is getting funded for this opportunity. Next slide. So I give that to give context, but then talk about really what you need to do. So there's going to be 2 parts to your application. There's the local application, which is going to be a Word document. It includes a series of attachments that we do need you to submit to us to that hsinfo@azmag.gov, making sure that we have all of your attachments. All 3 of those local applications, supportive services only, the housing project, and the HMIS project application are all available on our website. You're able to download those and then edit right into that Word document. It's a locked document, so you can only fill in the gray spaces where it allows you to fill in the word limit. And then the second piece is going to be the eSNAPS application. That is going to be a lot less technical in nature and more, what are you spending money on, and is this an eligible expense? So the local application is where you're going to spend a lot of the time explaining what you're doing, how are you spending that money, who are you hoping to serve, and that eSNAPS application is going to be more just kind of checking the boxes, making sure you're spending things that are eligible. Next slide. This is where all of our materials can be found, and this will be sent out to you. You'll be able to see this PDF of slides and be able to click on all of these. These are also on our website. If you go to azmag.gov/program/homelessness, you will see resources and trainings right there on our homepage, and you'll be able to see the Continuum of Care funding opportunities. That is where Kelly mentioned that there'll be those applications, there'll be a timeline for you to review, there'll be these slides, kind of all the different resources you need, as well as the scorecards. I highlight the scorecard because that is how we are judging your how the rank and review is going to be evaluating your application. So make sure that you review that for the application that you are completing. Next slide. As Kelly mentioned, we have a list of resources. This is going to be really helpful. We are happy to provide any support, but also these other resources, how to get through eSNAPs, what you need to know, how to apply, all of those things. HUD has great resources. You're welcome to reach out to us, but HUD is really the place that I highly recommend to go to. These next two links are, one is to the NAH, National Alliance to End Homelessness. They did a great webinar, and also kind of like key takeaways to know and some fact sheets. Really helped us kind of wrap our heads around this notice of funding opportunity and didn't want to recreate the wheel. And then HUD also did a series of webinars to really understand both the unsheltered and the rural set aside. And so that is available to you, as well as all of our staff. A quick note, you have not heard us mention the rural set aside at all. We are not eligible to apply for that and will not be applying for it. So even though we have a couple of rural jurisdictions in our area, we don't fall into a majority rural continuum of care. Next slide. I wanted to quickly highlight before we go into just answering questions and kind of opening up the floor. Natalie, you commented, and I'm not sure I understand your comment about newly built projects. And so didn't know if you had more information or wanted to share. Natalie, I saw you take yourself off mute, but I cannot hear you. So if you want to drop information in the chat, that'd be great, or feel free to let us know. And then, yeah, we'll just open it up for any questions or thoughts you all have.
Dr. Padilla, would you like us to go through Coordinated Entry 101 for you?
Sure, that'd be great.
Katie.
Yeah, so coordinated entry run kind of separately for singles versus families. Singles is run by our Human Services campus, but has a series of access points, both mobile and fixed locations across the valley. Our family side is based in one location at UMOM, with a couple of fixed locations off that and one or two mobile sites that they can go and do evaluations at. Basically, the process, Kelly kind of described it really well, being a funnel to get you connected to the best resource for you. In our system right now, we have adopted what's called the VI-SPDAT, the Vulnerability Index, with a lot more acronyms. And basically it is kind of a questionnaire or survey to really understand what your needs are and then get you connected with the best resource, whether that's permanent housing, a rapid rehousing intervention, or we can get you reconnected with family, or kind of divert you out of our system. Really the goal, the requirement by HUD, but something that we really use to get people connected to the right resource. I will say it's not a completely unflawed system, which we all know, but is something that has been adopted across the US. Natalie, thank you for that further description. There is not in this case, because we have no acquisition or rehab allowed in this notice of funding opportunity. So most of this funding is available. It would be used in that same year, for example. So if you're providing supportive services, you're expending that right away. If you're providing rental dollars, you're expending that right away. So there is not a use period for dollars spent. You do have to spend it in that one fiscal year, whatever you apply for. Little bit different in this year. Is a little bit of a unique nuance because this is a one-time funding for 3 years. HUD will still be expecting you to spend down 1/3 of whatever you apply for during those 3 years, but they will not be taking back money if you don't spend it down. So if you apply for $3 million over 3 years, they are expecting that you spend about $1 million per year. If you have a slow to start, you can expend that money in year 2 or year 3, or if you have a quick to start, year 1 would be able to, you could spend more in year 1 than year 2 and year 3. Terrence, yes, the new housing project application would be something that you would use for rapid rehousing. So housing would apply to joint transitional and rapid rehousing projects, and permanent supportive housing projects. All of those fall into that bucket of housing. Other questions? You're also more than welcome to reach out to us. Kelly had her email, and you can reach out, or you can reach out to our hsinfo@azmag.gov, and we will get questions answered as they come in.
I will say I did find it very helpful to go back and rewatch the HUD and the Alliance webinars and to review the questions that were asked by others and the answers provided through both. There's a lot of insight in there into what both HUD and the Alliance think a successful application will look like. Great tools.
Are those in the last 2 things that you, okay, thank you.
They're also included, they were linked to the PowerPoint, and the PowerPoint will be posted on the AZ Mag website that I've included here in the chat as well.
Thank you.
Mm-hmm. I'll also just make a pitch for this. If you are not planning on applying, or you don't know if you're planning on applying and this ends up not being the right opportunity for you, but there is someone on your staff with either lived experience or who is a person of color and you think would be a good fit for our rank and review committee, we're also trying to make sure both of those voices are adequately represented on rank and review, and we would really appreciate hearing from you. We expect that to be between a 5 and an 8 hour time commitment. We recognize it's not a small ask, but it is critically important that we have folks who are not applying for these dollars help us determine who should receive them across the continuum.
Terrence, we have not linked the intent to apply, but it will be on the page by the end of today.
That and the link to this webinar today are the 2 items that we do not have posted quite yet. Jean.
I have a question. So I don't know for sure if Glendale is going to be the applicant or if we will just be partnering, for collaboration for our homeless master services agreement. But we have employees that actually work for the city of Glendale now who have been hired from our Glendale Works program. Thank you, Jasani, from Phoenix Rescue. That would probably be ideal to serve on the panel. My question is, would they be eligible if the city is going to be a partner on an application for these?
If they are City of Glendale employees, likely not.
Okay. All right. Thank you.
Thanks for thinking of them, though.
Yes, we do appreciate that very much. Okay, not seeing any other questions. Please know that you do have our team available to you if anything comes up. Please feel free to reach out to us directly or use the hsinfo@azmag.gov email address. I've put that in the chat. Again, we will have all of these materials posted by the end of the day, and we really want you to be successful in your application. So we are willing to help however we're able. If you have any questions at all, please don't hesitate to reach out. We're walking through this with you, walking right alongside with you. And it's great practice for the annual notice of funding opportunity, which we expect to be working on as well pretty soon. Thank you all very much for the hard work you do in our community. We appreciate you, and we look forward to seeing what creative approaches you come up with. And we really hope that we are able to bring this extra $28 million to our region. Okay. Have a great rest of your afternoon. Thank you, everybody.